I'd always been quite active. I did quite a lot of sports and stuff as a younger guy. And I'd kind of stopped doing sports when I started having my first kid so much. And I started to get back in and started running to work. And I started to get a kind of a numbness behind my knee that I couldn't kind of walk on that leg properly. I have a herniation in one of my lower discs, so there's obviously pressure there which is causing the swelling and causing some pressure on my sciatic nerve down my right leg, hence the pain in my leg. So obviously if you can take the pressure off, then the disc can kind of come back into shape a little bit, or at least not bulge so much.
Unique to the IDD therapy is a mobilization capability. So when the joint is opened, it then mobilizes, and this has an effect on the soft tissues. So we're opening it, holding it, and then we're mobilizing at the point at which the joint is open.
Well, ViMove's just these sensors that could monitor how my back was moving over a period of time. And there's a kind of a calibration session for about 20 minutes, I think, where you do some initial movements to sort of set the boundaries for how your back behaves under normal conditions. And then really you just go about your day doing your normal stuff.
We have this new technology which helps to monitor people's movements, and it'll help us to quantify your movements before and after treatment.
Having the numbers there to support, to show change, can really kind of give you some early indication of encouragement just to see that the treatment's working.
This is just an extra special tool that will really help us long term, because to get it on paper, to show it to the patients is, very important.
So now that my back pain is alleviated, it really feels like a new lease of life, effectively. I'm able to do the things that I wanted to do before. I can play with my children, and literally throw my son up in the air and catch him, and he's giggling and laughing. That to me is worth any amount of money spent on treatments, that I can do what I want to do.